My name is Kevin Hodges, and I am the EMS Medical Director for Adams County, Benton County, Franklin County, and Yakima counties appointed by the State Department of Health. My purview is all EMS medical care, all pre-hospital medical care in those counties. I'm also a local emergency physician working in Kennewick and in Richland. I got to talk about the stress on the system that this pandemic is causing. First off, it's an already stressed system. We kind of tend to operate at capacity for lots of good reasons, but hundreds per day of positive COVID patients on an already stressed system is causing really unprecedented in terms of what I've ever seen stress on an already stressed system. The effect on EMS providers and other healthcare providers and the patients and the families is by far the worst I've ever seen. And this has a cascading effect. As the hospitals get full of admitted patients, not just COVID patients, but people suffering from the things that they always suffer from, strokes and heart attacks and other medical problems. As the hospitals get full of these patients, that fills the emergency department. As the emergency department fills up, that fills up the emergency department waiting room. As those fill up, that transmits down to the EMS providers. So not only are local people going to the emergency departments having increased wait times to be seen because of the backup on the system, but it also causes problems for EMS providers and for EMS agencies, in that the hospitals that get too full may go on diversion, which means they're diverting all ambulance traffic as in an attempt to decompress the hospital and decompress the emergency department. So that has a profound effect on EMS and on EMS patients, in that now EMS agencies or the ambulances may not be able to transport patients to a specific hospital because that hospital and emergency department are so full and so backed up. So that means longer transport times. So longer transport times, instead of going to a close hospital, they may have to go to a hospital that's very far away, which means that 911 unit is out of service and not covering their area for prolonged or for a significantly increased period of time, which stresses the 911 system further and has other effects where the patients may not be able to go. The ambulances may not be able to take the patients to the hospitals of their choice. Doesn't matter if you always go to one hospital. If that hospital's closed and diverting 911 patients, then they have to take you someplace else. So that causes a significant amount of frustrations, of course, for the patients, of course, for the family, but also for the EMS system, and puts additional stress on the EMS system. And that's just the system. The providers are some of the more tragic, or some of the most sad parts of what I'm seeing in this pandemic is that the EMS providers and the emergency medicine providers and healthcare providers in general are forced to watch the devastating effects of this disease on very frightened patients and their equally terrified family members. And we see how much they're suffering and for how long. Whether if they die, that's terrible, of course, but not even when they survive the infection. The amount of suffering involved and for how long they suffer is terrible. And it's the fact that this prolonged suffering or this suffering in general is mostly preventable is the worst part. This is the disease of, at this point, this is a disease of the unvaccinated, and unfortunately continues to be spread by ignorance of public health measures or flaunting of public health measures. EMS professionals, hospital workers, emergency department workers, health workers in general are stretched to the breaking point, seeing this preventable suffering day after day, and it's taking its toll. EMS providers are on the front lines and are frustrated. We're seeing frustration, burnout, early retirements, and that's putting an additional stress on the systems. People don't want to quit because they don't want their coworkers to have a greater work burden, but they can't continue seeing this kind of suffering and walking away unaffected. So it's taking its toll, and it's taking its toll from the top down. People thank us, all the time. And so social media or in person or if we're in uniform, Oh, thank you for being on the front lines. Thank you for your service. We know it's hard. Yes, yes, it's very, very hard. But if you want to thank us, get vaccinated. If you want to thank us, follow public health and mask mandates to reduce the spread of this. If you want to thank us, listen to the real experts, the healthcare experts and the healthcare and the virologists and the epidemiologists. Listen to those experts. Don't listen to the pundits. Don't listen to the people on social media. Listen to the real experts. And if you're already doing those things, there's no need to thank us because you already have. Thank you very much. I'll turn it over to Dr. Person.